Hey, wonderful students. I hope you are doing good today. And today I'm here again to give you an introduction of this specialty of basic and gynecology's coding scenarios. Here we have a patient here by name Jessia, 19-year-old female, and came for consultation today. The consulting diagnosis is right upper quadrant pain. History of present illness. The patient is a 19-year-old gravida 1 para 1 African American female who present to the emergency room complaining initially of right upper quadrant pain. The patient also described bilateral diffuse tenderness over her low abdomen as well, and a small amount of abnormal discharge. Through the emergency room, she was noted to have positive chlamydia test. Please take note here. An ultrasound finding that were consistent with a general pelvic infection, likely due to the advancing chlamydia infection. The patient also has low hemoglobin and possible blood in her stool and is being evaluated by gastroenterologist. Past medical history otherwise negative, past surgical history negative, past gynecology history as stated above, a previous chlamydia infection, obstetric history, full-term vaginal delivery. The patient had a possible chlamydia test during the pregnancy and was treated. Allergies, no non-drug allergy. Medication, the patient take no medication. Physical examination, general. There was no abnormal rebound or guarding. Genitourinary, on vaginal exam, the patient has mild to moderate cervical motion tenderness and uterine tenderness. There is minimal adnesia tenderness and there is no palpable adnesia mass. Laboratory data. Today, the patient's white count is 6.6, which is down from 7.5. Her hemoglobin is 8.5, which is down from 10. Ultrasound demonstrates a complex mass in the right adnesia between the ovary and the uterus, meaning 1.9 times 1.8 times 1.5. Also noted is a thickening of the fallopian tube. There is no abscess noticeable. Assessment and plan: pelvic inflammatory disease and positive chlamydia infection. The patient has got an approximately 48 hours of intravenous doxycycline and the cefazine. The patient's exam is consistent with resolving pelvic inflammatory disease. From a gynecology standpoint, the patient will be stable for discharge home whenever her admitting doctor feels that all of her issues have been resolved. It is my recommendation that the patient be sent home on 14 days of doxycycline 100 milligram prescription oral bead and 14 days of flagyl 500 milligram prescription oral bead and zofaren 4 milligram prescription oral bead to be taken before her antibiotic dose to prevent vomiting up of her antibiotics. She should follow up with costacal obstetric gynecology in 3 weeks for a recheck and discussion of contraception. Signed by Dr. Arizona Robbins, MD. on 14th August 2022 at 10:51 a.m. Here we can figure out that during the diagnosis, we noted positive chlamydia, and then we noticed pelvic inflammatory disease. And here in assessment, our responsibility as medical coder is to go to the assessment and study this record carefully. And then here, you can define a code software that has been provided here and come here to index search, because I like to use index search because I've used it consistently and have kind of getting acquainted with it. So my keyword here, my main term here would be disease. And then I have pelvic because it's a pelvic inflammatory disease present. And then this is female, and there is chlamydia. So there is a combination code for the diagnosis here. Because of this, you have to go through the include notes. They say include sexually transmitted disease due to chlamydia, trichomastis. And then you have to go to exclude 1 and exclude 2. Go to coding guide notes, the chapters, to make sure that you confirm the whole thing here. If you want to go to CPT assistance, please take note here. You can go here. But there is no information provided for this code so far here. And you can go to dictionary here. Chlamydia disease, pelvic inflammatory disease, female, inflammatory pelvic. And then you can check. Feel free to open anything that you want to open. The ones that are subscribed will open for you. So I will now come back here and now enter my code here, which is A56.11. Here, I will add it. So I have evaluation management for consultation here. So I will come back for procedures here. Go to CPT. I have evaluation and management codes here. Meanwhile, this worksheet has been provided for us. So this consultation inpatient. So here in the worksheet, I really want to open this worksheet so that we can all see it. Yeah. Remember that test that these patients went to outpatient hospital, but then this patient at the same time was admitted. So this consultation has made it clear that the patient was consulting from a place that she was admitted. So we have to master all these medical decision making, and okay, so we should master our medical decision making procedures, and then as we do, we can just come here and now say that this patient was admitted because we can see it because the patient is in the emergency room, and we can just come here and see observation. It has a straightforward decision making and a problem focus. So remember everything that you learn about medical decision making here and bring it to practice as you code. So here, this is my code, 9952, and I'm going to add it. When I do, I will link it, and then I'll submit. And when I submit, you see my results. I will now have the walkthrough open here. I have to carefully go through the walkthrough and make sure that even if I get it right, and make sure that I understand it further. So you have, once the level of history examination and medical decision making is established, the code is then determined based on whether 2 or 3 keys of the key components are necessary, along with the location where the evaluation management service was performed. So this inpatient consultation, which requires 3 key components with an expanded problem focus, history expanded focus, problem focus, examination, and straightforward medical decision making, the appropriate evaluation management for this visit would be 99252. So due to the documentation of the chlamydia female pelvic inflammatory disease, the code is A56.11. Good luck, nice coding for you.